Every night, you fall asleep without thinking much about how your body's positioned. But what if that single habit, the way you sleep, is quietly affecting your brain, spine, digestion, breathing, and even your heart? Some sleep positions can protect your spine, others may worsen acid reflux, and a few might even increase your risk of sleep apnea. For decades, people have claimed your sleep position reveals your personality. But today, we're asking a much more important question. What does science actually say is the healthiest way to sleep? By the end of this video, you'll know 1. Which sleep position is best for your body, 2. Which positions doctors warn against, and 3. Why there is no one-size-fits-all answer. In the 1970s, psychoanalyst Samuel Dunkel proposed a popular idea that the way you sleep reflects your personality. For example, sleeping on your back meant confidence. Curling up meant sensitivity. Sprawling out meant dominance. But while these theories captured public imagination, they lack scientific evidence. What science does show, however, is something far more important. Sleep position can significantly impact your health, from spinal alignment to breathing, digestion, circulation, and muscle recovery. How you sleep matters. So let's break it down using biology, anatomy, and medical research. Despite hundreds of creative names like the soldier sleeping position, the free faller position, the mountain climber position, and the starfish sleeping pattern, sleep experts simplify everything into 4 basic positions. 1. Back sleeping. 2. Side sleeping, it may be left or right. 3. Stomach sleeping, and last one is combination sleeping. Now we will explore each, including benefits, risks, and who it's best for. Why babies sleep on their backs? Medical guidelines recommend babies sleep on their backs, especially in the first year. Why it's so? Because back sleeping helps in many ways. Like it, keeps airways open, reduces risk of choking, and significantly lowers the risk of sudden infant death syndrome. As children grow, they begin moving more during sleep, eventually forming habits that follow them into adulthood. Why most adults sleep on their sides? Studies show that, by adulthood, approximately 60% prefer side sleeping, 20% sleep on their back, 15% sleep on their stomach, and the rest shift between positions. This isn't random. It's influenced by comfort, anatomy, and health. Now let's analyze each position scientifically. Position 1, stomach sleeping. Why it is the least recommended position, sleeping on your stomach places your body in a twisted, unnatural posture. There are some scientific drawbacks for this sleeping position like, first, neck must rotate sharply that may lead to cervical strain. Second, spine loses its natural curve. Third, lower back compresses. And fourth, increased pressure on muscles and joints. Studies link stomach sleeping to these conditions, like chronic neck pain, lower back stiffness, and nerve compression. However, in specific medical cases, health specialists recommend this sleeping position. For example, certain respiratory conditions benefit from prone positioning. Hospitalized patients with severe lung issues are sometimes placed this way, but for healthy adults, doctors generally discourage it. Now let's talk about other sleeping position, often called back sleeping. First, we discuss benefits of back sleeping. Back sleeping allows even weight distribution, neutral spinal alignment, and reduced pressure on joints for people with lower back pain and hip discomfort. This position can be helpful, especially with a pillow under the knees. Along with benefits, there are certain risks with this position as back sleeping can worsen snoring and sleep apnea. Why it is so? Simple answer is gravity, because gravity causes tongue and throat tissues to fall backward, and airways get narrowed down, leading to vibration that produce snoring. And as far as sleep apnea is concerned, this position can increase breathing pauses and reduce oxygen levels. That can be dangerous. Third position is side sleeping. It includes 2 types, left side sleeping and right side sleeping. No doubt this is the most recommended position, but both sides carry some benefits and risks as well. When we talk about benefits of left-side sleeping, research shows that left-side sleeping can reduce acid reflux, improve digestion, support lymphatic drainage, and it improves circulation during pregnancy. Because your stomach sits slightly to the left, gravity helps keep stomach acid from flowing upward. However, downsides or risks of this position may include pressure on left shoulder and hip, and possible numbness if unsupported. Now let's talk about right-side sleeping. This position is beneficial especially for people with congestive heart failure and enlarged left ventricle because it can reduce chest pressure and improve comfort. However, it may slightly increase reflux symptoms in some people. During sleep, spinal alignment always matters. Side sleeping works best when pillow fills the space between head and mattress, second pillow placed between knees, helping the spine remain straight. On the other hand, poor alignment cancels the benefits. Fourth and last one is combination sleeping. Most people change positions 20 to 30 times per night. This is not a flaw, it's a survival mechanism. These sleep movements are beneficial as it relieves pressure, restores blood flow, and prevents nerve damage. Unless you have a medical condition, moving in your sleep is normal and healthy. What science really concludes: there is no single best sleep position for everyone. The healthiest position depends on various factors. For example, spine health, breathing, digestion, heart condition, pregnancy, and chronic pain. Doctors agree on one thing: sleeping comfortably while keeping your body properly aligned is more important than forcing yourself into a perfect sleep position. Here emerges an important question: that how to optimize your sleep position? Doctors, researchers, and advisors agree on same narrative that instead of forcing change, one should use supportive pillows, improve mattress quality, focus on spinal alignment, and most important is to address specific health needs. The way you sleep isn't just a habit, it's a biological process that affects nearly every system in your body. So tonight, when you turn off the lights, remember, your body already knows how to protect itself. You just need to support it the right way.
Don't forget to press the bell icon.